హలో ఎవ్రీవన్, వెల్కమ్ టు ఎన్ హెల్త్. నేను మీ రమ్య చౌదరి. సో ప్రజెంట్ ఎయిర్ ఫాల్ అండ్ ఎయిర్ లూజ్ అనేది చాలా కామన్ అయిపోయింది అండ్ మళ్ళీ రీగ్రోత్ అనేది టఫెస్ట్ థింగ్. సో అందుకే అందరు ఇప్పుడు హెయిర్ ట్రాన్స్ప్లాంటేషన్ చూస్ చేసుకున్నారు. మరి హెయిర్ ట్రాన్స్ప్లాంటేషన్ని చూస్ చేసుకోవాలి అని అంటే చాలా డౌట్స్ ఉంటాయి. అంటే హెయిర్ ట్రాన్స్ప్లాంటేషన్ చేసుకునేటప్పుడు ఏమైనా ప్రాబ్లమ్స్ వస్తాయా, అసలు ప్రోస్ ఏంటి, కాన్సిక్వెన్సెస్ ఏంటి, ఇలా చాలా డౌట్స్ ఉంటాయి. సో మరి ఆ డౌట్స్ అన్నీ మనతో క్లారిఫైగా చెప్పడానికి డాక్టర్ ప్రదీప్ గారు మనతో ఉన్నారు. వారితో మాట్లాడదాం. హాయ్ సార్.
Hello.
హౌ ఆర్ యూ?
Perfect. And thank you so much for having me today.
యా, థ్యాంక్ యూ సార్. సో హెయిర్ ఫాల్ ఉన్న వాళ్ళందరూ హెయిర్ ట్రాన్స్ప్లాంటేషన్ని చూస్ చేసుకుంటున్నారు. ఫస్ట్ అసలు హెయిర్ ట్రాన్స్ప్లాంటేషన్ ఎలా చేసుకోవాలి, అంటే చేసిన తర్వాత మనకు వచ్చే ప్రాబ్లమ్స్ ఏంటి, అవన్నీ మాట్లాడుకునే బిఫోర్ అసలు హెయిర్ ట్రాన్స్ప్లాంటేషన్ అంటే ఏంటి సార్?
Ramya, hair transplant is a process in which hair is taken from one part and planted in where it is not there. So ये एक ऐसा है जैसे पौधे को एक जगह से निकाल के दूसरी जगह पे लगाते हैं. So it is transplant. That is transportation of a hair from the root from one place to another place. So that is the science. So
Okay.
but there is a lot of art behind it. No two hair on our hair scalp are similar.
ఓకే.
So every hair has got a different angle, different direction,
ఓకే.
and different curvature. So there is a lot of artistry.
ఓకే.
So that has to be the first important thing, artistry, because face is an artwork by God.
ఎస్.
So similarly, when we are doing hair transplant, the hair has to be planted in a very artistic way. That is very, very difficult. If the doctor and the team who are doing it, they are not artistic, then they will not do a good job. They will grow hair, but you can make out from a distance that it is transplanted. Then
Okay.
that is not a good job.
ఓకే.
So a great hair transplant is when it is artistically looking so natural that nobody can make out.
ఎస్.
So hair transplant is a amazing artwork based upon the platform of science.
సో బిఫోర్ దట్ వాట్ ఈస్ ద మెయిన్ రీజన్ ఫర్ హెయిర్ ఫాల్ సార్?
Ramya, in males, the main reason for becoming bald, that is becoming bald from front, mid or back, is the male hormone.
ఓకే.
Genetically, males are susceptible, they are at risk for becoming bald. So when they are at risk of baldness and when there is right age it starts, when the hair lifestyle is not healthy, then it grows faster. So that is the main reason of baldness for males.
ఓకే.
But for females it is different. Sometimes it is hormonal, sometimes it is nutritional. So baldness or hair fall in females is different. In
Okay.
males it is primarily genetic, and because of the genetic susceptibility and the male hormone which we need in the male body,
Okay.
that is the reason for
Okay.
baldness. Yes.
Okay. Actually, we need 5 main reasons for hair fall, sir. So, what do you want to say about those 5 main reasons?
For males and for females they are different. For males the main reason for hair fall is, I would not say hair fall, the hair thinning is the male pattern baldness because of the male hormone. And when males they lose a lot of hair, then
Okay.
usually that is due to some disease or some let's say they are losing weight rapidly or some nutrients are not there. So nutritional second thing.
Okay.
Also in males sometimes when they do chemotherapy for cancer,
Okay.
then also the hair, almost all the hair they fall up, but they come back.
Okay.
And if there is some deficiency like vitamin D, usually
Yes.
that happens.
It's a
in,
common thing.
Common thing.
Yes.
So there can be hair loss. But when you fix the vitamin D, then it comes back. In COVID, when the disease was severe, when COVID was very kind of advanced for people, then they also lost hair. But again, the hair comes back. Then something called alopecia areata, where round patches happens in the beard or in the scalp. That
Oh.
happens. When that happens, that is due to unknown reasons. That is kind of autoimmune. That also usually gets better with treatment, and sometimes it also gets by its own it kind of recovers.
Okay.
Then another thing is there you can have lichen planus, some scarring alopecia. that means some kind of disease, then scalp happens. If you don't treat them at right time, then also there could be patches of hair loss which is permanent. Even
Okay.
hair transplant does not work on those kind of patches. So this is for
Oh.
males. Now coming to the females. The female, the main reason for females to lose hair is nutritional. Usually they have kind of when they go for rapid weight loss, or there is some kind of crash dieting, they are not having a particular vitamin in their diet, so they lose weight and also they lose hair.
Okay.
So that is fixable.
Okay.
Then when there is hormonal issues in females, that is called PCOS or
Yes, yes.
PCOD, that term is also evolving and changing. Then they have got there is problem in the hormone, female hormone in the body. Then other secondary characteristics are there of the PCOS, including losing hair from the center, widening of the midline.
Front.
Front.
Okay.
That happens in females, and you have to
Okay.
go for proper evaluation, taking help of an endocrinologist and a gynecologist, and yes, you can find a solution for that. That is for the. Then also females, they have a tendency to have a generalized hair loss when if they have got thyroid.
Thyroid
So,
issue.
yes.
Okay.
So that is also one of the common causes for females to lose hair.
It
But
is
again,
applicable for men also, right?
the thyroid issues are a little bit lesser in males, but it is more common in females.
Okay.
But it is not 100%. Males are immune; they can have, but females are the thyroid cases are more in females, hypothyroidism.
Okay.
Then also postpartum, like after delivery,
Okay.
there is some of the females they lose hair, and again that lasts for a few months post pregnancy. So that is again recoverable. So these causes of females are, you have to go to a qualified doctor,
Okay.
a dermatologist or a hair specialist who only practices this, and you have to know that the doctor practices this day in day out,
Okay.
and then they will identify the cause and they will give a scientific treatment.
Okay.
And you have to also see whether the treatment is scientific or they are doing gimmick with us, because just to hold the patient, lot of quacks, they promote lot of things which are not scientific. They will try to do inject on your scalp, they will try to give something as a supplement which is not required, and they will very, very costly. You will be going for online ordering them, you will go for online consultation. So a lot of platforms are there which are not scientific.
Okay.
So you feel, since they are technology based, a lot of people feel like they must be good, but most of them are backed by quacks.
Okay.
So you have to go to a qualified proper doctor, sit across one-to-one, and they would analyze, they would see the case. Then if there is needed, they will be doing investigation. Then you will have a proper diagnosis. They will treat you.
Okay.
So yeah, so these are the causes for
Okay.
male and female, and solution is ultimately have to go to a qualified doctor. That is my message here I want to give you.
So, on which stage we have to consult doctor, sir, for hair transplantation?
So Ramya, when there is a significant hair loss, that means the patch is visible.
Okay.
You can see it in the mirror, or you can see it in the ceiling when you are in the lift, or your friends are poking you, or they are saying there is a bald patch there. So if that has come, then definitely that is the stage you should definitely go to a doctor. But much before that, if you have got a family history of baldness,
Oh.
then by 19, 20, let's say your father was bald by when he was 30. So if you hit by 19 and 20, definitely that person should go to consult a doctor.
Okay.
In that way, so you can go to a doctor at a stage where still it is at the kind of initial stage, and you can fix it only with medication. There is no
Okay.
need to go for a transplant. So yeah, so this is an amazing trick that I want to give to all the males, all the boys, kids whose father are bald.
Suffering from.
Yes, so when my father was bald when I was 35. So when I turned 30, then I started feeling there is something happening here.
Okay.
I started taking medications. Now I'm 47. So my hair is good because the medication that I'm taking. But my cousins and some of my relatives who are not taking this medication,
Prevention is better than cure.
100%.
Yeah.
So you can prevent it. So it is this baldness is preventable.
Okay.
So if you choose the right doctor and go to the doctor at the right time, then you can prevent altogether a hair transplant.
Okay.
However, once once that area is empty, then definitely have to go to a doctor.
Okay.
And there are stages. At early stage, only medicines can recover it.
Yes.
And if you go to an advanced stage, then you have to do a transplant to fix that area along with medication, so that no further baldness is there, the progression is stopped.
Okay.
Then if you go to a stage like Boni Kapoor, where he was totally bald, the maximum baldness that can happen, that has happened to him, then medicines won't work.
Okay.
Then you will have to do only pure hair transplant, and then only will grow hair.
So when we're getting hair fall, we do one thing. We select a product from online and we applied it and waiting for a result. So is it correct?
100% incorrect. It is not correct at all. As I have been telling since the beginning, so if you have got anything, it is a medical issue. Go to a doctor, consult, and consultation is not a big deal.
Yes.
And if you need, you can go for a second opinion also,
Okay.
another doctor.
Okay.
So in that way, you are very sure what is the exact cause. A parlor cannot treat you, or salon cannot treat you, online product cannot treat you, because they don't know what is the cause. They have not gone to medical school. They have not done any post graduation on the subject. They have not studied it. How they will be knowing it? So this just to save the consultation fees, people try to do kind of this kind of shortcut, and they end up with some some kind of treatments which will damage their hair and skin permanently.
Permanently. Oh.
Yes. So that is 100%. As a qualified doctor, as a responsible doctor, I would like to tell all your audience, don't go for a shortcut. Go to a qualified doctor only.
Okay.
Maybe 2 consultations or 2 doctors, second opinion, do that. But that will save you so much of money, so much of your time, and you will never be frustrated, and your trust on the medical science will never be kind of depleted if you go to a doctor to do a consult.
So plantation means we think it's a painful process. So actually, I thought it was a myth.
Yeah, I would say it is not pain-free, but it is not painful either.
Oh.
So that means just like insulin syringe, we all draw blood. We tolerate that. So in again, it all depends on the person who is doing it. It is not a commodity. It is not an iPhone, or it is not a TV that you buy. It is same all over the world. It is not. This has got a lot of skill that is involved. It depends. Let's say somebody does it every day, has done it for, let's say, 5,000 or 10,000 patients, and the skill, the softness, everything that would come, versus somebody knows the theory but just started, it will be different. Our people, they do only this, nothing else. So the injections that we give, our nurses give, doctors give, that is, even a small child can take that injection, because we know by what means we can make it so smooth that it won't hurt. It won't be a bad experience in terms of getting the injection. So you have got many maneuvers, techniques that we add, so that it is close to kind of zero in terms of pain.
Okay.
But at the same time, I would not say it is painless.
Okay.
But it is not like, that is not a scientifically correct term, painless. But yeah, it is close to zero pain in our center at Eugenics Hair Sciences that we do, because we only do this thing, nothing else.
Okay.
In all our centers, Delhi, Mumbai, Hyderabad, Bangalore, Bhubaneswar, we do only hair procedures. So our people are experienced in doing that. However, let's say somebody who just started, or they are 1 year, 2 year, and they do multiple things. They do hair, they do skin, they do laser, they do plastic surgeries or whatever.
Okay.
Then they will not be experts in one thing.
Okay.
Their hands will be doing many things, so they might be more painful. The patients might, there are a lot of people, they come from Turkey or some other clinics where they are run by quacks. They come to us, they say, it was very painful, it was so much swelling, so much. So we don't get those kind of things since we do only this thing since 2010. So the skill, talent and passion of doctors, people vary.
Yes.
So also the end results also vary.
Yes.
It is not the same thing that happens in eugenics that we do at our centers versus somebody else who does just started. It will be, the gap will be like 0 and 100.
So what is exactly process, sir?
So Ramya, what happens is once somebody consults us, comes
Okay.
to us and he says that I've got a hair loss issue, then we just ask him to come to the center physically. If not possible, come on video after sending the pictures. We have got an amazing AI system where
Okay.
we take the pictures and analyze it patient much before you interact the patient.
Okay.
And then we analyze his area which is empty and the area from where we take. Sometimes you go other parts of the body for the donor also. And then we see if we can prevent further hair loss only by medications.
Okay.
We try, I would say more than 90% of the patients, when they come to us for the hair loss, we just give them medication and they all recover. They are not needed for a transplant.
Oh.
They thought they will do a transplant. We say you don't need a transplant. You go back and you'll be happy. The way I'm happy without a transplant.
Okay.
The 10% people who, according to our clinical judgment, they need a transplant. So we analyze everything, take their pictures, we see what are the areas to be, and we don't try to be aggressive. Just because we know how to do the transplant, we don't jump, we don't plant hair where it will look very juvenile or very young.
Okay.
We try to make it very age appropriate so that he can defend it when he will be 50, 60 also.
Okay.
And then we analyze the donor from where the hair is to be taken. Let's say the recipient area is too big.
Okay.
Like again, once again, I will give you the example of Boni Kapoor. Then we try to take hair from other parts of the body also, like beard. Like in case of Shankar Mahadevan, we took a lot from his beard.
Okay.
Let's say you think of Muhammad Ajruddin, our very hero
Yes.
from here. We took something from his beard also, because the area where we have to plant, that is too big.
Okay.
So we explore other body parts, but they are not the first choice. First choice is skull. So we analyze everything, then put it on the screen, discuss on the table with the patient, tell them all the options. We also tell them hair transplant is not necessary. It is a cosmetic thing. It is not a medical thing. If you still, because it is to look good only. It is not something that you need to survive. If you, and we don't push anybody for the procedure.
Okay.
If he is okay, he knows exactly, and we should be on the same page. He should have the expectation. He should not have expectation that I will look like, some fancy hero, and the hair will be that dense. We say hair transplants are not perfect.
Okay.
It has got the transplanted hair, the density will be this much less, and it in our hands it is very artistic, looks close to natural, but still it is man-made. Even though people they treat us as the artists in this line.
Yes.
All over the world people come to us because they feel we do art on the hairline.
Yes.
Still we say that it is still man-made. So we tell all those things, what are the things which are not possible.
Okay.
And when all those things patient accept and they say yes, then we take him for the procedure.
Okay.
And on the day of the procedure, everything is cool. It is nothing very special requirement. Some basic blood tests are needed, so that is sugar and blood pressure. All those things are normal.
Okay.
And then so we have got our technique that we have given to the world, which we kind of pioneered and we published, called direct hair transplantation.
Okay.
So that technique is the most latest technology or philosophy, or I would say the scientific step in which the whole world does the transplant now.
Okay.
So we do that, and the whole like as I said, we have published that. We have not patented that. So that all the doctors all over the world, they can use that. So
Okay.
with direct hair transplantation technique, we do the transplant where grafts are immediately planted on the skull,
Okay.
where they are needed in an artistic way.
Okay.
The right angle, right direction, right curl, and right density.
It's a one-time process for life.
Usually it is one time, but sometimes when somebody's baldness is progressive, then he can go for a second sitting because the new patches are coming up. So if medications don't work, then the new patches will come up. If medicines work, then he might not develop a new patch. So again, person to person vary, and everybody's case is different.
Correct.
But I am giving you a generalized overview.
Yes, yes.
So, but everybody's case will be different. The
Okay.
medicines required will be different. Some people might not need a medicine like Boni Kapoor because there is no scope of retaining any hair.
Okay.
The baldness is maximized. But let's say Mohammed Sami,
Okay.
his initial area was bald. We fixed it. New areas came because he for his sports, some of the medicines he could not take. He thought there will be the dope and all that. So new areas started coming up.
Okay.
So he has to do a transplant if he wants to fill that.
Okay.
So he's managing by keeping the hair long.
Okay.
So there, everybody's case is different.
Okay,
The
yes.
age at which he is coming, the baldness in which, the speed in which the baldness is progressing, family history, and you have to keep a lot of points into consideration. And here comes expertise, experience, and one-pointed focus, your talent, your ethics.
Yes.
All those things comes into picture. For that reason, as I said, the end results of hair transplant vary widely because expertise, intelligence, and skill, passion, ethics of people also vary widely.
Plantation is it harmful to our brain and head, sir?
Not at all. In experienced hands, the procedure is very, very superficial. It is not more than 3 to 5 millimeter deep into the skin.
Okay.
The
3
hairs,
to?
5 millimeter.
Okay, millimeter only. Okay.
The nib of the pen,
Oh.
that much you go deep and you kind of leave the graft there, and the graft gets anchored and slowly it grows. If scientifically it was done at the right way. Again, if somebody is a quack, somebody they don't know all those things, they have only seen some videos or they have worked with some doctor, they have seen it from a distance, and they open up the people in salons that do it. Then there are a lot of things, the sterilization issue, there could be infection, there could be septic
Yes,
reactions.
yes,
Some
yes.
people have died to that. There
Oh.
could be, reactions to the medicines. The medicine people take, including the painkiller or the anesthetic agent which has been given. So people can react to them in a way that they can develop some kind of reaction, and that can be fatal. That has happened in the
Okay.
past.
Okay.
And if I am not wrong, something has happened in Hyderabad also once.
Oh.
So for that reason, you have to choose your doctor wisely. You have to see
Correct.
whether he is a qualified doctor or the clinic. You have to see the reputation, their work,
And
the
experience matters.
body, 100% the body of work. You have to see what the right way to do kind of research is, to ask them, other than hair transplant, what else you do. If they say we are doing many things, that means that is the first question, the filter in which you know that this person is not expert in one thing, he is doing many things, he would do a very bad job on me. That is one question. You can filter it out. You
Okay.
can cut across all your options.
Okay.
Then you have to see since how many years you have been doing. Can you show me some of the results of my skin color, my hair texture, my grade of baldness, and my age? If that clinic can show you hundreds of those kind of results, that means they have been experienced. Then you
Okay.
say, can you make me talk to some of your people who were of my kind of comparable parameters of baldness? If they could do so, then
Okay.
they should consider them. Of
Okay.
course, price is one thing. I am not discussing about cost part,
Okay.
but the most important thing is safety part, so that you should not be regretting.
Okay.
Almost, Ramya, on a daily basis, we get patients from all over the world. They come for correcting their procedure
Correcting the process. Oh.
because they went for impulsively to a clinic or somebody who is not experienced, because he was very cheap and he was just at the nearby house,
Yes.
and they jumped for it without any research whatsoever, and they got a bad procedure, and they were depressed for many reasons. And earlier we used to get a lot of patients from Pakistan. Now they can't come. We used to get a lot of patients. They have to come through UK and for fixing their beards, because they have got bad. They look like kind of bhalu bolte hain usko.
Oh.
Because wrongly they know how to transplant, but they don't know how, where not to do a transplant. What is called under correction. Then
It's an art, sir, actually.
200% it is an art.
Yes, sir.
So yeah, I feel very bad when we correct somebody's procedure. Muhammad Azharuddin's son, Asaduddin, from Hyderabad, he had got a very bad procedure before, and he was very sad. So when I was doing Azharwai's procedure there in Delhi, he came. I saw him. I said, I took 5 days to fix his bad procedure, and that turned something nice for him, and he's looking so good. I'm feeling so happy whenever I see him. He's just like a child to me.
Okay.
And yeah, that gives joy to me whenever I see him, because when he came to me, he was so sad about his hair.
Okay.
And but it took me 5 days to correct his bad angle hair.
Sir, you had a 17 years plus of experience. So how many surgeons have you done, sir?
Ramya, we have started in 2008, month of
2008,
August.
okay.
Yes. So this month we started. Now we just completed 18 years.
Yeah, 18
We
years.
started from Rishikesh, from the Himalayas,
Okay.
and then Dehradun, Mumbai, Delhi, Hyderabad, Bhubaneswar. We're just opening in Bangalore, and we get people from more than 90 countries, and we have done close to 22,000 plus patients, maybe more, and we have got close to 450 people working with us day in, day out, only working on hair restoration, more than 20 doctors. So yeah, so
Sir,
this
we
is
want to know about your brand and your experience and your positive response. We
yeah,
want to know.
so yeah, Ramya, the company that we set up, the name is Eugenics Hair
Eugenics.
Sciences.
Okay.
So we do only sciences of the hair.
Okay.
So we do nothing else. So we are concentrated on only one subject, which is only 3 to 5 millimeter length, called hair.
Okay.
So anything related to hair, the scientific thing, me and my wife, Dr. Arika Bansal, we both are co-founders of this company. We have done our MD dermatology
Okay.
from the prestigious AIMS New Delhi.
Okay.
So we completed in 2008. Then we went to Rishikesh. We started from there, and then after 1 year of practicing dermatology, we realized we should do only one thing, that is hair. We stopped our skin practice and focused only on hair. Then developed the technology called direct hair transplantation. Then wrote a book. Then people from all over the world started coming to us for the results.
Okay.
And the most difficult patients in the planet, USA, UK, Australia, they all have come to us. And there are third-party patient forums, British, German, American. Their founders, their managing directors, they all have come to us.
Oh, great.
And they have declared that Eugenics is the #1 hair transplant place in the planet for
Okay.
complicated cases. And when the whole world says no, 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 Eugenics will say yes, 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 because they have got the skill.
And now, why Hyderabad, sir?
Of course, this is the capital of the South.
Yes.
But in a way, to me, this is the capital of the whole of our country. This could be the second capital, political capital. But Hyderabad, the most happening thing happens in Hyderabad. The energy, the buzz, the youngsters, and all those things that happens in Hyderabad. And when we were in Delhi and Mumbai, our 60-70% patients used to come only from Hyderabad and Bangalore, and from southern places. In 2019, I was invited by prominent people of Hyderabad that I should come here, and we were nearly ready to open something in 2020. But in March, when the COVID happened, so then it got postponed. Then we started putting our energy in Mumbai and all. But Hyderabad, it is IT backed. Telugu people, they do a lot of research, and they are very, very in our line. What I saw, they do scientific research. They are very quality sensitive.
Okay.
They are not price sensitive, unlike we encounter people in Delhi.
Okay.
So here people, they want quality.
Yes.
So if you have got a quality, then there is no brainer.
Yes.
So, and that gives energy, that gives, anybody who comes, why people from all over the world, they come to Hyderabad? Because the people here, they are quality sensitive. And Telugu people the diaspora is all over the world.
Correct.
Wherever I go, whether I go to USA, UK, Australia, London, wherever I go. So when I meet Telugu people, so, you can feel the quality sensitivity they have.
That
And,
aura.
Yes, yes. And they are like the warmth and
Yeah.
everything. So that has pulled me. And it was, Hyderabad was so much welcoming. And we came here, and now we get some amazing response here. Now we are thinking of creating our headquarters in Hyderabad, shifting from
Great.
Delhi to Hyderabad. We
Okay.
are planning to open something close to the airport where it will be a residential program.
Yes.
That means people who come from all over the world as medical tourism, they will come, they will stay in our facility for 4, 5, 6 days, do the procedure, do that inner healing and outer healing of the hair, then they would go back. So that's his pipeline. potentially the project will start within few months, and that will be the crown village of India to the world, and Hyderabad will be the epicenter of that.
Great.
So these are our pipeline things for Hyderabad.
Sir, we want to know what are the pros and cons of hair transplantation?
The pros are, of course, we know that you will whenever you will see the person in the mirror, you will like it, because you have got the bald areas which was there, they have been covered, and you are looking a newer yourself.
Yes.
And there are so many thousands of stories that make us so much of emotional.
Okay.
Many stories are there. A person comes, he says, doctor, and I wanted to commit suicide because my daughter told me don't come to pick me up from the school. सब लोग बोलते हैं कि ये गंजे बाप की बेटी है. So then he comes, he says, doctor कुछ करिए आप. Then you fix his hair, it looks natural, and things. He says,
Yes.
doctor, you gave me new life, not only to me, to my daughter. Somebody says, some actor says, I was getting the role of father or elder brother. Now I'm getting proper roles of a lead actor. So you saved my career.
Yes.
So there are many stories like that.
Okay.
Many.
Okay.
And somebody says that when I want to dress up well now, look at Boni Kapoor. He lost 25-30 kilos after he got his hair.
Correct.
He was plump and all that.
Yes.
And he lost all the weight because hair came in. He got the and after 60, people say it is new 40. So after 60, they said we need to have muscle, we need to have teeth, and we need to have hair, because now life has just started. Because with longevity, people would like to look good, and that gives them energy to go out and be their best and perform their work, the profession, in the best possible way.
Okay.
So here the pros are so many things, and good thing is normally it is not it doesn't need any maintenance. You don't have to really go for medications and all that in most of the cases.
Okay.
And it is one-time job. If you have done it in the right hands, if you have done the research well, we always say do it once, do it right.
Okay.
And if you do it right, then it doesn't need any maintenance. These are the pros. Coming to the cons, the only one con that I know is after you get hair transplant and you get a good look, you will spend a lot of money on your clothes.
Correct. For a maintenance. Yes.
So you will spend a lot of money on your clothes, and you will go to restaurant, and some people say that that they are getting more traction.
Yeah.
So those kind of things. But if you have not chosen right clinic, right doctor, then that can be very catastrophic.
Okay.
If you have got a bad procedure, it is much worse than remaining bald.
Okay.
So I kind of urge all your audience, do your research. Research might take 6 months,
Yes,
1 year.
yes, correct.
Go to
Exactly.
multiple forums, meet many clinics, go to multiple clinics, go to meet many doctors, meet many past patients, and talk to them, see them in person. So that will kind of, that investment of 5-6 months, which will usually cost nothing, that will save you from doing a grave mistake. And you should try to know the details of the procedure. And you can come to Eugenics Hair Sciences to our website, meet any of our personnel, or the brochure that we have. If you go through them, 90% you will be so much educated that you will take a voluntarily well-informed good decision, and you will never regret it.
Correct.
You will save much more money and many more things, your emotion and your faith on science also, if you do the research well.
So finally, anything do you want to say to our viewers about Unix and hair transplantation?
Dear ones, all those people who would be watching it later, and all the Telugu audience all over the world who are so much quality sensitive, please do your research. Don't jump into hair transplant. Once you realize that you have got hair loss issue, go to multiple patient forums, talk to multiple clinics, doctors, ask them to give you a lot of references of patients or people who were like you. If they have kind of produced amazing results for them and they are happy, then the clinic will share their references with you. Talk to at least 10 patients of different clinics, and then you will be much more educated. Also try to go to a clinic who do only hair transplant. If they do many things, then obviously they will be mediocre in everything. They will not do justice to your procedure. They will do something which will be substandard, which is not up to mark, and will be unhappy forever. So this is the my suggestion to all of you, and we always say at Eugenics that do it once, but do it right by doing right research. Thank you.
Right, sir. Thank you. Thank you so much, sir. It was really nice talking to you.
Thank you. Thank you, Ramya, for having me, and I hope your audience will get some
Got it.
scientific insights
Yes.
and they will do the research well
Yes.
and they will not do a mistake.
Yeah.